Question 1. A patient prescribed carbamazepine asks the nurse about its use. The nurse explains that the medication may be used to treat which of the following conditions? A. Alzheimer's disease, B. Chronic pain, C. Epilepsy, D. Parkinson's disease. Correct answer, C. Epilepsy. Carbamazepine is primarily used to treat epilepsy, also known as seizure disorders. It works by stabilizing the electrical activity in the brain and is particularly effective for certain types of seizures, including partial seizures and tonic-clonic seizures. Question 2. A patient prescribed clopidogrel, 75 mg, to be taken daily for the prevention of a myocardial infarction, asks the nurse why this medication is necessary. What type of medication does the nurse explain clopidogrel is? A. ACE inhibitor, B. Antiplatelet medication, C. Diuretic, D. Statin. Correct answer, B. Antiplatelet medication. Clopidogrel is an antiplatelet medication. It works by preventing platelets in the blood from sticking together and forming clots. This is particularly important for patients at risk of myocardial infarction, heart attack, as clots can block blood flow to the heart. By inhibiting platelet aggregation, clopidogrel helps reduce the risk of clot formation and subsequent heart attack. Question 3. Which common side effect should the nurse instruct a patient diagnosed with epilepsy about when prescribed valproic acid? A. Encephalopathy, B. Hallucinations, C. Hyperammonemia, D. Tremors. Correct answer, C. Hyperammonemia. Valproic acid is a medication commonly used to treat epilepsy, as well as other conditions like bipolar disorder and migraine prevention. One important side effect of valproic acid is hyperammonemia, which is an elevated level of ammonia in the blood. This can lead to serious complications, including confusion, lethargy, and, in severe cases, encephalopathy, brain dysfunction. Patients taking valproic acid should be monitored for signs of hyperammonemia, and if detected, the drug may need to be adjusted or discontinued. Question 4. A patient has been taking lamotrigine for 2 years. Which of the following would indicate that the patient is experiencing the intended effects of the medication? A. Lower hemoglobin A1C, B. Lowered blood pressure, C. Reduced tremors, D. Seizure-free. Correct answer, D. Seizure-free. Lamotrigine is an anticonvulsant medication primarily used to treat epilepsy, particularly in managing seizures. The intended effect of lamotrigine is to reduce or eliminate seizures, especially in patients with conditions like focal seizures, generalized tonic-clonic seizures, and certain types of epilepsy. Therefore, the best indicator of the intended effect of lamotrigine would be the patient being seizure-free. Question 5. A nursing student is caring for an elderly man taking ropinirole. After researching the medication, she learns that ropinirole is used to treat which of the following conditions? A. Alzheimer's disease, B. Benign prostatic hyperplasia, C. Parkinson's disease, D. Schizophrenia. Correct answer, C. Parkinson's disease. Ropinirole is a medication that belongs to a class of drugs called dopamine agonists. It is primarily used to treat Parkinson's disease, a neurodegenerative disorder that affects movement. Ropinirole works by stimulating dopamine receptors in the brain, which helps improve symptoms of Parkinson's disease, such as tremors, stiffness, and bradykinesia, slowness of movement. Question 6. Which medication should the nurse anticipate the physician will order for a patient at risk of developing a peptic ulcer following a traumatic accident? A. Loperamide. B. Ondansetron. C. Pantoprazole. D. Sucralfate. Correct answer, C. Pantoprazole. After a traumatic accident, the body is under significant stress, which increases the risk of stress-related ulcers or peptic ulcers, particularly in critically ill patients. The most effective way to prevent or manage these ulcers is by reducing stomach acid production. Pantoprazole is a proton pump inhibitor that works by inhibiting the proton pumps in the stomach, which reduces acid secretion. This helps to prevent ulcer formation and promotes healing of the stomach lining. Question 7. In educating a client who has recently been diagnosed with gastroesophageal reflux disease, which of the following non-pharmacological interventions should the nurse emphasize? A. Eat dark chocolate. B. Elevate the head of the bed. C. Increase caffeine intake. D. Smoking cessation. Correct answer. B. Elevate the head of the bed. Gastroesophageal reflux disease occurs when stomach acid flows backward into the esophagus, causing symptoms such as heartburn, regurgitation, and discomfort. Certain lifestyle changes can help manage GERD and reduce symptoms. One effective non-pharmacological intervention is to elevate the head of the bed. This position helps prevent stomach acid from traveling back into the esophagus, especially during sleep, as gravity helps keep acid down in the stomach. Raising the head of the bed by 6 to 8 inches, using a wedge or blocks under the bedposts, can significantly reduce nocturnal reflux and improve symptoms. Question 8. What is the most important assessment for the nurse to perform on a patient taking oral contraceptives during her annual pelvic exam and medication refill? A. BUN and creatinine. B. Blood glucose. C. Blood pressure. D. Oxygen saturation. Correct answer. C. Blood pressure. Oral contraceptives, particularly those containing estrogen, can increase blood pressure due to fluid retention and vasoconstriction. Therefore, monitoring blood pressure is crucial during checkups and medication refills, as elevated blood pressure may necessitate adjusting or discontinuing the contraceptive to reduce cardiovascular risks. Question 9. A patient is administered an intramuscular injection of depot-medroxyprogesterone acetate. Which common side effect should the nurse inform the patient about? A. Dizziness. B. Increased bone density. C. Weight loss. D. Weight gain. Correct answer. D. Weight gain. Depot-medroxyprogesterone acetate is a long-acting form of birth control, often administered as an intramuscular injection. A common side effect of DMPA is weight gain. This occurs in some women due to changes in appetite and metabolism, as well as possible fluid retention. Question 10. The nurse is caring for a patient who is taking tamoxifen for breast cancer prevention. Which of the following signs would indicate that the patient is experiencing a side effect of tamoxifen? A. Arrhythmias. B. Confusion. C. Constipation. D. Flushing. Correct answer. D. Flushing. Tamoxifen is a medication used for the prevention and treatment of breast cancer. It works by blocking estrogen receptors in the body, and because of this action, it can cause side effects commonly seen during menopause, as estrogen plays a key role in regulating body temperature. Flushing, hot flashes, is a very common side effect of tamoxifen, similar to the hot flashes women experience during menopause due to decreased estrogen levels. Question 11. Which of the following is considered a potential side effect of subcutaneous heparin in an 8-year-old hospitalized patient? A. Diarrhea. B. Leukopenia. C. Thrombocytopenia. D. Tinnitus. Correct answer: C. Thrombocytopenia. Subcutaneous heparin is used to prevent and treat blood clots, but a significant side effect, especially in pediatric patients, is thrombocytopenia, low platelet count. Heparin-induced thrombocytopenia, HIT, occurs when the immune system reacts to heparin, leading to platelet activation and a risk of bleeding, making it crucial to monitor platelet levels during treatment. Question 12. Which of the following lab values is consistent with a diagnosis of ketoacidosis in a 22-year-old male patient? A. PaCO2 of 40. B. Blood pH of 7.29. C. Serum bicarbonate of 27 mmol. D. Serum glucose of 90. Correct answer: B. Blood pH of 7.29. Ketoacidosis, particularly diabetic ketoacidosis, occurs when the body breaks down fat for energy, leading to ketone accumulation and a decrease in blood pH below 7.35. A pH of 7.29 is consistent with ketoacidosis. PaCO2 of 40 is normal and does not support ketoacidosis, as the body usually lowers PaCO2 to compensate for acidosis. Serum bicarbonate of 27 mmol is also normal. In ketoacidosis, bicarbonate is typically low. Serum glucose of 90 is normal, while in ketoacidosis, glucose levels are usually elevated above 250 mg/dl. Question 13. What instruction should the nurse give to a client with pulmonary tuberculosis to obtain a sputum sample for a culture and sensitivity test? A. Cough deeply and expectorate into the container. B. Expectorate into a container after a respiratory treatment. C. Cough after pursed lip breathing. D. Save sputum for 2 days in a covered container upon waking up. Correct answer: A. Cough deeply and expectorate into the container. To obtain an accurate sputum sample for a culture and sensitivity test, the patient needs to cough deeply to bring up sputum from the lungs, not just saliva or mucus from the mouth. This ensures the sample contains the bacteria, Mycobacterium tuberculosis, for proper testing. Question 14. A patient with AIDS visits the clinic and expresses concern about a potential tuberculosis exposure a month ago. According to the nurse, what minimum measurement of induration on a PPD test would be considered positive for this patient? A. 1 mm, B. 3 mm, C. 5 mm, D. 10 mm. Correct answer: C. 5. In patients with HIV/AIDS, the threshold for a positive PPD, purified protein derivative test, is lower due to their compromised immune systems. For most individuals, a PPD induration of 10 milliliters or more is considered positive. However, for people with HIV/AIDS or other immunocompromised conditions, an induration of 5 milliliters or more is considered positive, as their immune response to the tuberculin skin test may be weaker, and they are at higher risk for progressing to active tuberculosis. Question 15. A nurse is caring for a patient after a hypophysectomy. Which of the following potential signs should the nurse be alert for as an indication of a serious complication? A. Blood pressure of 156/82. B. Decreased urine output. C. Hyperglycemia. D. Polydipsia. Correct answer. B. Decreased urine output. Decreased urine output can be an indication of SIADH, syndrome of inappropriate antidiuretic hormone secretion, where excessive ADH, antidiuretic hormone, causes water retention, leading to hyponatremia, low sodium levels, and fluid overload. This can be a serious complication that requires urgent treatment. Question 16. The LPN is caring for a patient with ascites related to liver failure. The patient experiences hypotension and cramps. Which of the following is least likely to be related to these symptoms? A. Decreased renal blood flow. B. Excessive IV intake. C. Increased aldosterone. D. Recent diuretics. Correct answer. B. Excessive IV intake. In liver failure with ascites, excessive IV intake could exacerbate fluid retention, but wouldn't directly cause hypotension and cramps. Hypotension and cramps are more commonly linked to decreased renal blood flow, increased aldosterone, or electrolyte imbalances from diuretics. Question 17. A patient arrives at the ER complaining of joint pain that started in his great toe. Which of the following risk factors, if present in the patient's history, might the nurse suspect triggered the patient's condition? A. Lacto-vegetarian diet. B. 1 glass of wine weekly with dinner. C. Smoking. D. Vegetarian diet. Correct answer. C. Smoking. The patient's complaint of joint pain starting in the great toe is indicative of gout, a condition caused by elevated levels of uric acid, leading to uric acid crystals accumulating in the joints, often starting with the big toe. Smoking is a known risk factor for gout as it can contribute to increased uric acid levels in the body and hinder the kidney's ability to excrete it. Question 18. A patient presents to the ER with chest pain and difficulty breathing. The nurse auscultates the patient's breath sounds and finds the left side clear while the right side has no sounds. What other symptoms might the nurse anticipate observing during further assessment? A. Bruising of the right flank. B. Deviation of the trachea to the right. C. Distended jugular vein. D. Hepatomegaly. Correct answer. B. Deviation of the trachea to the right. The absence of breath sounds on the right side of the chest indicates the possibility of a pneumothorax, which is a collapse of the lung due to air in the pleural space. If the pneumothorax is severe, tension pneumothorax, it can increase pressure in the chest and cause tracheal deviation away from the side with the collapsed lung. This is a life-threatening condition that requires immediate intervention. Question 19. A primigravida at term is admitted to the birthing room. When the client is 8 centimeters dilated, she expresses the urge to push. The nurse advises her to pant blow at this stage because pushing could A. Cause cervical edema. B. Led to a precipitous birth. C. Prolapse the cord. D. Rupture the uterus. Correct answer. A. Cause cervical edema. At 8 centimeters dilation, the cervix is not fully dilated, and pushing prematurely can cause cervical edema, swelling, or injury, which could slow the progression of labor or lead to complications. Encouraging the patient to pant blow or breathe through contractions helps prevent this premature pushing while the cervix continues to dilate. Question 20. Which of the following skin manifestations in an infant most concerns the nurse? A. Irregularly shaped macular patch on the left side of the face. B. Raised 3-inch by 4-inch bluish-purple area. C. Irregularly shaped light pink patches on the back of the neck. D. Large red patches. Correct answer. B. Raised 3-inch by 4-inch bluish-purple area. A raised bluish-purple area suggests a bruise or contusion, which could be a sign of trauma or a vascular anomaly like a hemangioma. A significant raised bruise can also raise concerns about potential abuse, bleeding disorders, or vascular malformations. Question 21. A patient has recovered, and it is time for the physician to remove the chest tube. During the procedure, what should the nurse instruct the patient to do? A. Bear down and hold his breath. B. Inhale slowly. C. Relax. D. Take deep, slow breaths. Correct answer A. Bear down and hold his breath. When a chest tube is being removed, it is important for the patient to perform a Valsalva maneuver, which involves bearing down and holding their breath. This action helps to prevent air from entering the pleural space, which can cause a pneumothorax, by increasing intrathoracic pressure as the chest tube is removed. This action ensures that the pleural space is sealed, reducing the risk of complications. Question 22. A 6-year-old boy with a cast on his left leg rings the call bell. Which of the following statements by the boy indicates the need for immediate intervention? A. Can you give me a ruler so I can scratch my leg inside my cast? B. My leg feels funny. C. My leg itches. D. The edge of the cast is hurting my skin. Correct answer A. Can you give me a ruler so I can scratch my leg inside my cast? Inserting objects into a cast can cause injury, infection, or damage to the skin. This request requires immediate intervention to prevent harm. Question 23. Which nursing consideration is most critical for preventing a rise in intracranial pressure in a patient with meningitis? A. Maintain a quiet environment. B. Cluster all nursing care into one session to allow for rest. C. Keep the lights on in the patient's room to improve orientation. D. Maintain a calm atmosphere. Correct answer A. Maintain a quiet environment. For patients with meningitis, particularly those with potential or already elevated intracranial pressure, ICP, maintaining a quiet and calm environment is crucial to help reduce stimuli that could contribute to increased ICP. This includes minimizing loud noises, sudden movements, and excessive stimulation, which could worsen the condition or lead to complications. Question 24. A 36-year-old female client is scheduled for a mastectomy in the morning. What is the primary responsibility of the nurse? A. Checking for any missing lab works. B. Explaining the procedure and outcomes. C. Obtaining the consent for surgery. D. Taking the vital signs. Correct answer. C. Obtaining the consent for surgery. The nurse's primary responsibility is to ensure that informed consent is obtained from the patient. This includes confirming that the patient understands the procedure, risks, and benefits, and that they have had the opportunity to ask questions. Question 25. A nurse working on the medical surgical unit assesses a patient admitted with a broken hip. The patient is coughing, has a low-grade fever, and reports night sweats. What action should the nurse take first? A. Administer an antipyretic to the patient. B. Assess the patient's pulse oximetry. C. Give the patient a blanket to ward off chills. D. Place the patient on airborne precautions. Correct answer. D. Place the patient on airborne precautions. The patient's symptoms of coughing, low-grade fever, and night sweats are concerning for a potential infectious disease such as tuberculosis, which is airborne and can spread to others if not properly isolated. Airborne precautions are the first priority in this situation to prevent transmission to other patients and staff. While assessing pulse oximetry, administering antipyretics, or giving a blanket may be helpful later. Ensuring airborne precautions are in place immediately is crucial for infection control. Question 26. The LPN is caring for a patient scheduled for electroconvulsive therapy, ECT. Which of the following actions requires additional intervention prior to the procedure? A. Pre-therapy medication has been administered as ordered. B. The patient has been NPO for 8 hours. C. The patient has removed his or her jewelry. D. The patient's intravenous line has been removed. Correct answer? D. The patient's intravenous line has been removed. For electroconvulsive therapy, the patient typically needs an intravenous line in place for the administration of anesthetic and muscle relaxant medications. If the IV line has been removed, this would need to be addressed before proceeding with the procedure, as it could delay or prevent proper medication administration. Question 27. A diabetic patient suddenly exhibits confusion and diaphoresis. Which action should the nurse prioritize first? A. Administer glucagon 4 as ordered. B. Administer insulin as ordered. C. Check the patient's blood sugar. D. Offer the patient a small apple juice. Correct answer. C. Check the patient's blood sugar. Confusion and diaphoresis, sweating in a diabetic patient, can be signs of hypoglycemia, low blood sugar. The first priority is to check the patient's blood sugar level to determine if it is low. If the blood sugar is low, then the nurse can proceed with the appropriate action, such as offering juice or administering glucagon. Checking the blood sugar is essential before administering treatment to avoid causing harm by giving insulin if the patient's blood sugar is already low. Question 28. Which laboratory value would indicate an adverse reaction to ticlopidine, an antiplatelet drug? A. 15 g/dl. B. 235 mg/dl. Fasting. C. 3.1 meq/d. 500 cells mm3. Correct answer. 500 cells mm3. Ticlopidine is an antiplatelet drug that helps prevent blood clots by inhibiting platelet aggregation. One known adverse effect of ticlopidine is bone marrow suppression, which can lead to a low white blood cell count, specifically neutropenia. If the absolute neutrophil count drops too low, this can increase the risk of infections. An ANC of 500 cells mm3 is considered low and would indicate a serious adverse reaction, requiring the discontinuation of the drug. Question 29. In examining an EKG waveform, which component indicates atrial contraction? A. P wave. B. QRS complex. C. T wave. D. U wave. Correct answer, A. P wave. The P wave on an EKG represents atrial depolarization, which directly correlates with atrial contraction. When the atria depolarize, it triggers the contraction of the atrial muscles, pushing blood into the ventricles. Question 30. Which of the following patients is least likely to develop hypernatremia? A. A patient taking anabolic steroids. B. A patient with chronic renal insufficiency. C. A patient with diabetes insipidus. D. A patient with extensive thermal burns. Correct answer. B. A patient with chronic renal insufficiency. Hypernatremia is a condition characterized by an elevated sodium level in the blood, often due to water loss or sodium retention. A patient with chronic renal insufficiency is least likely to develop hypernatremia because renal insufficiency typically leads to the retention of water rather than sodium. In cases of kidney dysfunction, the kidneys are unable to excrete water efficiently, which can result in dilutional hyponatremia, low sodium due to excess water, rather than hypernatremia.